Hello, good evening. It's Dr. Chudi Ufondu of Snowspirations Global Health Solutions. How are you? Today is the first day of November 2022, and we just have just 30 days in November to thank God and actualize our objectives. Now, this evening, we're going to talk about blood group or what we call blood type. We principally have two types of blood grouping, the ABO blood grouping and the rhesus factor blood grouping. Very important topic to the family, especially prior to hooking up with your partner. It's important you discuss your blood group. It's important you know your blood group because your blood group can shape the texture of your family. Your blood group can affect the health of your kids. So you need to be compatible. Now, in the sense of compatibility, thank God, if for some reasons you are not compatible with your partner, there are certain things we can do. So there's a particular drug we're going to give you. But for the purpose of this evening, please, when you join, tell me your own blood group. Make sure your blood group is confirmed. I told you guys story of how they got my genotype wrong, but I've always known that my blood group is O positive. So if you know your blood group, to make it easier for understanding, please share your blood group. I can see our amazing COO, Kenneth. Thank you so much. I can see Tosin, amazing lady. She's always around for all our clinics. Now, if you're joining from any part of the world, please let's know who you are. And when you join, tell us your name and also share your blood group if you want to. If you don't want to share your blood group, that's perfectly okay. My blood group is O positive. Now, Tosi's blood group is A negative. And I'm going to tell you the implications of her A negative blood group. So we're going to have fun. And immediately after this particular broadcast, we're going to quickly switch to our Facebook so we can understand this better in a bigger platform. We have a bigger platform in Facebook. Okay, so I hope you're enjoying November. November has been very rewarding in as much as we've got some, bad news here and there, but we thank God we made it up to November. Make sure your 30 days in November is amazing. Okay, so let's start. So you see, your blood group is actually a unique characteristic you inherit from your two parents. Your blood group is defined by two special proteins on the surface of the red blood cells. Red blood cells are the oxygen carrying substance in your blood. So there are different types of red cells. There are different types of blood cells. So we have the red blood cells, we have the white blood cells, then we have the platelets. This evening, we are focusing on the red blood cells. So your blood group is a special protein on the surface of your red blood cells. Now, there are principally two major proteins there, the A protein and the B protein. Now, when you have the A protein, it's called the A antigen. And when you have it on the surface of these red blood cells, your blood group will be A. When you have the B antigen, which means B protein, your blood group will be what? B. Now, if you have a combination of A and B, on the surface of the red blood cells, your blood group will be what? AB. If you don't have any of them at all, your blood group will be what? O. So for people like us, I don't have the A, I don't have the B, so my own blood group is what? O. Now, when we now go to the other classification of blood group, which is the rhesus factor, is also a special protein which is also seen on the cover of the red blood cells. When you have the presence of this protein in the red blood cells, you have rhesus positive. When you don't have it, you have rhesus negative. So for someone like Tosi, Tosi is A negative. So what's the implication of Tosin's blood group? Tosi has the A antigen on the red blood cells, but she doesn't have the rhesus factor. That's why she's A negative. For me, I don't have the A, I don't have the B. That's why I'm O, but I have the rhesus factor in my red blood cells. So I'm O positive. Now, Kene, our COO, might be B positive. So if Kene is B positive, what does it mean? Kene has the B antigen, and Kene also has the rhesus factor positive in her blood. Now, it's important to understand the implications of these two classification of your blood group. They will actually determine the health of your family, especially for the woman. Now, the major problem is what happens to the woman in the scheme of starting a family, because your blood group is inherited from your two parents. So the man will have two of this antigen covering the red blood cells. The woman will have two of these antigens covering her red blood cells. So whatever your mother gives you, whatever your father gives you, will determine if you're going to be healthy. So I'm going to explain further. So if your partner has A positive, be careful. That positive doesn't mean he has two positive. Positive is always dominant. So a man can have double positive. That's A plus plus, or B plus plus, or O plus plus. And he can also have A plus minus, or B plus minus, or O plus minus, but the plus is dominant. Are you following my explanation? The plus in that sign is dominant. So once you have one singular unit of the rhesus factor, it will dominate the negative. So the problem and the worry, it's for the woman. So like for Tosin now, if her partner is positive, and if after the first pregnancy, or after the first exposure, or after the first, procedure, she had amniocentesis, she had some procedures that led to crossing of the blood in her body, or she had abortion, or she had miscarriage, or she had stillbirth. What will happen if she's negative? Her body will get ready. If the baby she's carrying inside of her is positive, her body during that first exposure will build soldiers to wait for the baby that will come subsequently. Why would this happen? Because the likelihood that the partner of Tosi is positive. So the mother will see that positive as an enemy. The first exposure, the baby will be fine. But subsequent exposures, the body of the mother will build soldiers that will attack the baby. Am I making sense? This is very simple. If you spend time to understand it, you will never make mistakes. So every singular one of us is expected to have two numbers in your blood group. Like me, I have O plus plus. O plus plus means I probably picked the O from either two of my parents, but I picked the double antigen for rhesus factor. Now, if I had negative and plus, my kids can be positive or minus, depending on what my wife is. So I don't want you to confuse yourself. Just know you have the ABO blood grouping and the rhesus factor blood grouping. Rhesus factor blood grouping is the simplest, even in medical school, because when you have it, you're plus. When you don't have it, you're negative. The problem is when we begin to look at the ABO. But still very simple. So it's important for a woman who met a partner to have that conversation, because your partner will determine if you're going to have problems. If you are A negative and your partner is A negative, you can go to bed. Why? Because there is no wahala. There won't be any fighting. But if you are negative and your partner is either positive, two positives, or one positive and negative, that positive in your partner can be transferred to the baby. Once the baby you have on the inside is positive, the mother will build soldiers that will attack the second babies up. This is very important. Now, some women might be having recurrent miscarriages, recurrent stillbirth, and because they have not really gone for investigations, because we don't have their blood group, it might actually be rhesus incompatibility, leading to all those series of pregnancy losses. So it's important you have this conversation with your partner. Now, just the same way you will have conversation about your genotype, your blood group and your genotype are not the same. Now, thankfully, because of the efforts of researchers and some very sound doctors, we discovered a drug we can use to stop any adverse effect in a woman that is negative. So, like Tosin, I don't know if they've discussed this with you. So, since you're negative, after the birth of your first baby, subsequent pregnancies, we must administer a special drug called Rogan to you. Between 26 to 28 weeks, we must give you this injection. When we are giving you this injection, this Rogan is made from human blood. What the Rogan will do is to prevent the attack from the soldiers you've already made in your body from the second pregnancy onwards. So once we are able to give you the Rogan throughout your pregnancies from the second up, nothing will happen to your baby. Now, in some places, the availability of Rogan will also determine administering it to you within 72 hours of delivery. So there are actually two important portals you can get the Rogan injection within 26 to 28 weeks of gestation and within 72 hours of delivery. The essence of doing this is to avoid cross reaction. Once you are already exposed, the Rogan will not work. So very, very important. So if you're in a relationship now and you guys are planning to start your family, it's important to go to a good lab, a lab where they will take time and tell you your true blood group. Once your blood group is positive, you can go to sleep. You don't have any problem. I'm talking about a woman. Once your blood group is positive, you have nothing to worry about. Now, if your blood group is negative, that's where I begin to worry, because that negative will cause a lot of trouble. Now, the man, we don't care if the man is positive or negative. The problem is always from the woman. Because if your partner is negative and you're negative, they will just like each other, they will commingle and nothing will happen. But if your partner is positive and you are negative, that's where the problem starts. So all women who their blood group is A positive, B positive, AB positive, O positive, you don't have any problems medically. Now, all the women out there who their blood group is A negative, B negative, AB negative, O negative, please make it a point of duty to have meaningful conversation with your partner, especially starting from your second pregnancy. Now, it's advised that if you have had miscarriage in the past, if you have had termination of your pregnancy, if you have had ectopic pregnancy, if you had any procedure like amniocentesis, then once you contract that marriage, once you begin to want to have a baby, disclose this to your gynecologist. So if you notice, we ask a lot of questions. It's because of your history. Because assuming prior to meeting your partner, you've had 10 miscarriages or 10 abortions, and you don't volunteer this information to your doctor, and your partner is positive and you're still negative and you're not taking your Rogan, you might be losing your pregnancies, you might be having frequent miscarriages, and you'll be going from one church to the other without knowing there's a simple problem. So disclose all those information to your doctor. Disclose all those information to your gynecologist. They are life-saving. So thank God we have a solution, because once we give you this Rogan, you don't have any problems. But if we don't identify that, so many babies will not make it. You might likely keep having miscarriages. You might likely keep having pregnancy failures without knowing what the problem is. So it's important for everybody in this clinic tonight to please go and confirm your blood group. Don't go with the first opinion. I told you guys the story when I came to America. They made a mistake in my own genotype, not the blood group. So make sure you go to a quality lab. Make sure you know your genotype. Make sure you know your blood group before you even say I do. If there is anything I want you to quarrel about the things that will protect your family, because this is genetically determined. It means what you have is what your kids will have. So very, very, very important. Okay. Now, I'm going to collapse the clinic now, and I'll give you opportunity to ask your questions. I want you to ask me all questions related to this topic. If you have any confusion, I'm going to make it simple. So the clinic is going to open now. Please start asking your questions. Okay, so I can see Zana Henshaw. Thank you. You're from Abuja. Thank you so much. Please begin to ask your questions. Okay, Tosi, your husband is positive and you are negative. So I hope, I'm sure you live in America. I'm sure they gave you your organ injection, right? Because you need it for subsequent pregnancies. I know you told me you want to have another baby in 2024, so you have to take your organ between 26 weeks and 28 weeks. Don't miss this for anything. Oh. Then once you deliver your baby within 72 hours. Okay, so Zana Henshaw, thank you for coming. I have about other 6 people that are not really interacting. Please, if you can see me, feel free and ask your questions. Okay, Tosi, great job. So you're a candidate for Roga. So she's doing the right things. So I'm not worried about Tosi. So if, in as much as she's negative, I'm not worried because she's doing the right things. Okay, guys, ask your questions. Now remember, it's 30 days of lovemaking in our group. 30 days of making babies. We are not gonna relent because November has one magic date, one magic day, the day of your ovulation, and we can't predict that day of ovulation. It can be any day. It can be today. It can be the last day of November. So we cannot afford to miss November. So our resolution in our group is 24 hours love making. That means every day. Please, my people, if you need to drink water, drink water. If you need to exercise, exercise. If you need to eat good food, eat good food. But there is no exceptions. There is no excuses. We want to become pregnant in November and we want to go there because you might not know when you ovulate. So there is no need for timing your love making. Just make love every day. If you are bleeding, maybe an exception, but there are some people that are bleeding, they will still want to make love. If you want to do that, that's okay. Okay. Is any blood group less susceptible to disease than others? Now, for some reasons, which we have not really explained, we noticed, this is for the genotype, we noticed that people that have AA tend to be prone to having more malaria disease for some reason. We don't know. It looks like the sickle cell trait or gene, it's kind of protective against Plasmodium falciparum, which is the malaria parasite. Now, that's the only one I can tell you for sure now. But just like any other thing, there are some certain characteristics in your blood that might predispose you to developing some problems, and there are some that will predispose you to developing other things. So for the purpose of today, we're just going to limit it to only malaria. And that's for your genotype, not the blood group. Okay, thanks for imparting knowledge. The what makes O person a universal donor? Okay, so universal donor, remember, when you have O, you don't have any of the A, you don't have any of the B. So you don't have. So you can give. Is it making sense? So when you don't have, right? When you're O, you don't have A, you don't have B like me. I don't have A, I don't have B. So I can give. And there will be no reaction. But for someone that is A, you can only give to A. Because if you give to B, there will be cross reaction. For someone that is B, you can only give to B because if you give to A, there will be cross reaction. But if you're A, you can donate to anybody. So it's really, really important and critical. Now, the aspect you're talking about is in regards to blood donation, which we're going to talk for another day. We're talking about pregnancy in this gathering. So blood grouping is also important in blood donation. So in developed countries, your blood type, your genotype is part of your identity. In most countries, your genotype and your blood group will be in your identity card, your driver's license, because some people will opt to be donors. Some people will opt to be blood donors and organ donors. So there are unfortunately some people that might get involved in motor vehicle accident and they might be organ donors. So unfortunately they might die, but they have signed, contract that if they're about to die, they can take part of their body and they can give to other people. So when someone dies, unfortunately, the organs will not die immediately. They can harvest the organs and they can still give it to other people to save people. So some people can opt to be organ donors. Like I'm an organ donor. So if anything happens to me, I signed a contract that, hey, you guys can use any part of my body to go and save someone. So this is very important. And if you notice, when we are going for blood donation, we definitely want to know your blood group because we can't just give you any blood. But we're going to talk about that during another time, okay? I love that question, Tosi. Please keep asking your questions. Keep asking your questions. This is very important. Ask your question, please. If you don't know your blood group, make sure you check it before this month ends. Very important, especially if you're starting your relationship. Make sure you guys know where you stand in your relationship regarding your blood group and your genotype. Very important. Okay. All right, guys. So it looks like we've come to the end. We don't have much questions again. So that's about 20 minutes. Normally, I would have spent extra 10 minutes, but it looks like it's a pretty straightforward topic. So COO, if we don't have any other question, we can exit so we can get the Facebook clinic started on time and we can get a break. If we don't have any other question, then we are good to go. Just make sure you check your own. If today is the first day attending my clinics on YouTube, it's every Tuesdays. So every Tuesdays about this time, you will see me. Then immediately after that, I go to YouTube, I go to Facebook. Then on Saturdays, I come in a little bit early. Now we are gonna fall back over the weekend. So we'll have a lot of adjustments in our time. So be on the lookout for that. But Saturdays, I come in early. Tuesdays, I come in 6:30 p.m., 11:30 p.m. Nigerian time, 6:30 p.m. Eastern time US. Okay. All right. Thank you so much, Tosin. Thank you. Zana joined, but she didn't ask any question. Then COO, thank you so much. Guys, I will see you guys in Facebook. God bless you and enjoy the rest of your November. Bye-bye for now.